Orthopaedics Paediatrics Part 2, plastic bowing and fracture the radial head, child, fractured distal ulnar. This will do well. Hard to get a closed reduction, but you can take your time. There's huge remodeling potential. Closed reduction, supracondylar fracture, good position, correct the various alignment. Post supracondylar fracture of the humerus. Look how they hypersupinate. Doesn't really matter much, just note it. French osteotomy required here. Gunstock deformity following supracondylar fracture. Need to correct this various angulation. Pre-reduction X-ray fracture supracondylar, bit unstable, but will remodel actually. And here it is reduced. Closed reduction. Showing refracture of forearm, although we say they go on to healing. Here's one that's refractured through the healing callus. Supracondylar fracture in a 12-year-old. Physes almost closed here, require open reduction, internal fixation. Supracondylar fracture showing remodeling. And supracondylar fracture of the femur in a 2-year-old will require reduction, closed reduction, maybe hold it with K1. Here you use the II to get your closed reduction. Fracture of proximal humerus in a 7-year-old, as I said, huge remodeling potential. Stress fracture lower femur seen on bone scan. Stress fracture lower femur. Here's a subtrochanteric fracture. The patient got osteopetrosis, marble bone, high non-union rate. This is sort of splint I use post supracondylar fracture, but you can put a back slab on. Open fracture of the thumb in a child. Preserve length, don't discard tissue. Digit injuries in children can do remarkably well and they will heal. Tibial spine fracture here is non-displaced. Infection osteomyelitis of calcaneus in a 5-year-old, most unusual. Just stick to the usual principles of treating infection, antibiotics and debrief if required. Here's a osteomyelitis L1, a 10-year-old child presented with low back pain. First presentation, 2 weeks. Remember, take back pain seriously in children. Here's a punched out lesion, Staph aureus, ESR was elevated, so was a C-reactive protein. Pain here in the mid back. Here's pain swelling over the elbow. Can't move it. So what is it? Septic elbow. Moving it after drainage. See, septic elbow won't move it. Won't move it. Severe pain. Loose body in the elbow. Here. Need to remove that. Median nerve paresis. We've already spoken about this. Winging of the scapula from paralysis of branches of the brachial plexus. Osteochondritis dissecans here. May heal, may come loose, float around, may need to remove. Osteochondritis may be a normal variant, hard to tell, have to speak to radiologists. Osteochondritis dissecans, normally around here, can heal. Oshgood's letters, that's a traction apophysitis of tibial tubercle, may fragment, pain, treat non-operatively. Maltracting patella, common in young girls. Rides up and over the side, painful, develop chondromalacia, fasciolitis of the wrist. There's a plica in the medial gutter of a knee in the child, if they're inflamed, excise. Rickets, short stature, deformed lower limbs. Scoliosis with curvature spine, left slipped upper femoral epiphysis in a 9-year-old child. Sever's disease, increased ossification of the apophysis or the heel, can be very pain, treat non-operatively. L5S1 slip down here. Here's a slipped upper femoral epiphysis in children, pain, overweight teenagers, and again the head is slipping off the neck, head is slipping off the neck, head is slipping off the neck, head is slipping off. You have to pin it where it is in situ to stop it slipping anymore. You can sometimes do a gentle closed reduction, the acute one, but generally pin in situ. Here it is, marked external rotation. Sometimes present with knee pain. Cut tendo Achilles, 10-year-old, surgically repair it. Tumour, osteoidnitis, increased density here. Pain relief by aspirin. Punched out lesions in the foot of a child. Punched out lesions. Cole's disease. Hope you enjoyed this presentation.